So my name's Lauren Hughes. I'm the Director of Clinical Policy and Operations in the Medical Directorate in NHS England. And I've also got the privilege of leading the Supporting Local Transformation workstream, which is part of the National Maternity Transformation Programme. And this programme is really set up to take forward the recommendations from Better Births, which is the report of the National Maternity Review. And really what we're trying to do is to support commissioners, providers, professionals right across the NHS to come together, to work together, to break down boundaries and to deliver the care that we know that women, their families and their babies want and need and ought to have available to them. One of the key findings in the maternity review was that what we really need to see is professionals, commissioners and providers working together, breaking down boundaries. That might be midwives and obstetricians, that might be commissioners and providers, that might be CCGs working with their neighbouring CCG, providers working with their other providers in their locality. And really what we suggested was that they should come together into local maternity systems. Now all this means really is the commissioners, providers, professionals and the women and families in their community coming together to design and deliver the services that their communities want and need and ought to have. Now we imagine local maternity systems will cover a population of between 500,000 and 1.5 million people. It'll depend very much on their geography, their circumstances, and they probably will be on the same footprint as the sustainability and transformation plans that are being developed at the moment. And what local maternity systems will involve will be those commissioners and providers coming together, agreeing standard operating procedures, standard protocols, how they'll work together to deliver the services that their women want, how they'll be able to offer the choices that women in their areas want, and how they'll be able to keep women and babies safe within the services that are available to offer. So what we're going to be doing over the next few months is looking for a small number of local maternity systems who want to move forward quickly with implementing the package of recommendations that were set out in Better Births and really making that model of care that it set out a reality for the women and babies and families in their area. So we'll be coming out to try and identify some of those early adopters soon and really to provide them with some in-depth support to help them get on and deliver the model, but also so that we can learn from that model so that the rest of the country can get that experience and learning as they seek to transform their maternity services. And nationally we'll be providing support to that through the Maternity Transformation Programme, NHS England, NHS Improvement, lots of other national bodies there to support the early adopters, but also all local maternity systems really to live the vision that was set out in Better Births in the National Maternity Review.